Hello everyone, welcome to our Meet the Consultant Cosmetic Surgery webinar. Thank you all for joining us tonight. I'm Tracy Ace, I'm the Deputy Head of Clinical Services here at Santa Maria Hospital in Swansea. And I will be leading today's session with Professor Iain Whitaker and Mr. Amar Ghattaura. He'll join us at 7:30 this evening. Just to touch on some housekeeping bits before we begin. Firstly, when you joined the webinar, you would have heard a voice saying the session is being recorded. Just for peace of mind, your faces and names won't be seen on the video. We're recording it just so we can share the webinar on social media following the event. Secondly, there's a Q&A button at the bottom of the Zoom window. You can submit your questions here, but don't forget to click the anonymous box if you do not want your name to be shown. We already have a series of questions we'll be asking during this webinar, but we'll try and answer as many of your questions as we can live tonight. If we don't manage to get round to your questions, we'll share a Q&A document within the next 2 weeks following the webinar. Right, let's get started. You'll notice that I'm joined by Professor Iain Whitaker on this webinar. Professor Iain Whitaker is the world-leading cosmetic surgeon, one of very few professors within the UK, and has been a key part of our cosmetic surgery function here at Sancta Maria Hospital for a number of years. Iain, could you please introduce yourself and provide some background information on your experience and specialisms, please?
Great, thank you, Tracy, for inviting me today. And the introduction, I'm Iain Whitaker, as Tracy says. I'm Professor of Plastic Surgery at Swansea University, and I work as a consultant at the Welsh Centre for Burns and Plastic Surgery. I've got over 20 years of surgical experience. The last 11 have been as a consultant. I've worked in England, Wales, Holland, America, France, Australia, and Sweden in plastic surgery, and gained experiences from all over the world in advanced both reconstructive and aesthetic techniques. The past few years I've worked at Sancta Maria and done hundreds of cosmetic procedures. I've focused particularly on breast and body surgery, and over the past 2 or 3 years combined procedures, doing them both at the same time to do quite transformative, surgery all in one go in a safe environment. Obviously, depending on patient selection, BMI, etc., which we'll discuss later. My academic qualifications are vast, but I think it's important to focus on the results for patients. And I've developed over the past couple of years quite a significant number of Instagram before and afters, which will show you what is possible in each patient group. And I try and be as informative and fair as possible, explaining the pre-existing sort of, situation in the patient and what we're trying to achieve.
Lovely, that's great. Thank you, Iain. I'm sure you will all have many questions for Iain, which you can ask via the Q&A function. So as well as Iain's specialisms, we also offer the following at Sancta Maria. So breast enlargements, adjustments, lifts and reductions, abdominoplasties, liposuction, facelift, rhinoplasty, septorhinoplasty, pinoplasty, and there's lots more which can be found via our Sancta Maria website. This webinar will mostly be focused on the mummy makeover and breast surgery. But please ask any cosmetic questions you have in our Q&A function. And if we can't answer all the questions tonight, we will follow up with some answers for you within the next 2 weeks. So I'll kick off tonight's session with some frequently asked questions that Professor Iain Whitaker receives from new patients. Okay, so what exactly does a mummy makeover include?
So mummy makeover is a term which has gained a lot of traction over the past few years. And traditionally, it means combined surgery to the breast and the tummy. As the name sort of infers, it was traditionally for mummies who've had children, the effects of childbearing, both on the breasts and the tummy, in terms of skin changes, fat changes, muscle changes, and potential scarring from cesarean sections, etc. So the traditional mummy makeover is someone that's had children, wants enhancements to try and reach their sort of pre-childbirth physique. Normally it's combined, so both at the same time, but occasionally in certain circumstances, you'd want to split them up. And traditionally, I do the breast first and then the tummy second.
If you were having a full mummy makeover, what would usually be the first procedure?
So if I do them both at the same time, I almost always do the breasts first. And that can be either just simple breast augmentation. It can be breast augmentation with an uplift. It could be just an uplift if there's enough volume, but they want to lift the nipple higher and remove skin. Or it could be a breast reduction, which allows reduction of volume, improvements of shape, and moving the nipple higher and making it smaller. So there's quite a range of breast components. And then the tummy is, in my experience, it's traditionally a full tummy tuck. So that would be moving the tummy button, low scar under the underwear line, removing the excess skin, repairing the muscle underneath to make it a flatter contour, and some liposuction to the hips, midline and waist.
Lovely. And how long does the full mummy makeover take on average to complete from the first procedure to the last?
Okay, so if it's all at the same time, which is on the same day, it can take anything from 2.5 hours for breast augmentation, tummy tuck and liposuction and muscle repair in a very slim lady with a low BMI. It can take up to 4.5 to 5 hours if you're doing a breast reduction with a tummy tuck and liposuction. Obviously, patient selection is very important. Safety is very important. I personally don't want to be operating longer than 4.5 to 5 hours maximum because of the, small risk of blood clots and, problems with breathing, etc.
Okay. And can you lift fat from other parts of the body to another, such as fat from a tummy to enlarge the breasts?
There are ways to do that. There's fat transfer, which I believe will be discussed later on, which is liposucking some fat and then centrifuging it and then transferring it elsewhere. That is good in that you aren't putting implants in, but you can only put in lower volumes in my experience. We know 50 to 60% of it dies and it doesn't get its blood supply. And there can be complications such as cyst formations or fat necrosis. There are advanced techniques such as microsurgery to move parts of the abdomen to the breast, traditionally used in breast reconstruction in the NHS, which I believe Mr. Ghattaura will be talking about later as well. But the traditional way of enhancing volume at the moment would be with a range of breast implants.
And what is the recovery time like for a mummy makeover?
So one of the advantages of doing them both at the same time is you're obviously having one recovery instead of two. And as a rule of thumb, I normally tell patients to rest for 2 weeks, wear the binder, don't move around too much. And then you have a wound check at 2 weeks where you have a check with a nurse, check everything's healing okay. I can often pop in and have a look as well. And I'd say the next time is the 4-week mark where you're normally fit to go back to work, depending on how demanding work is, and you're getting more mobile. And then 6 weeks is normally a watershed where you can go to the gym and regain normal activities. Obviously, everyone's different depending on the size of the procedure and BMI, but I think 2, 4, and 6 weeks are good sort of time periods for, getting back to normal.
Lovely. How long before I can go back to work after the mummy makeover?
If you work from home, you could potentially work after a week, from home on your computer, etc. If it doesn't involve lots of driving and heavy lifting, 2 to 3 weeks. If you're a karate instructor, then it's going to be 6 weeks, for example. Yeah. So it'd be a bespoke discussion between patient and surgeon, but that gives a general idea.
Okay, lovely. So who is the ideal candidate for a mummy makeover? Who would you say is an ideal candidate?
So I think the term mummy makeover, I think, is a brilliant term in many ways, but I think there's been slight slippage in its use. So sometimes I have patients ask for mummy makeover when they haven't had children, for example, they've just lost weight, or the extreme if they've lost a lot of weight. So the ideal person would be someone who's got a BMI within the healthy range, so from 18 to 25, and predominantly their reasons for seeking surgery are child related. So they've had children which has stretched their skin and their muscle and has distorted, the shape and support of their breasts. So, we're recreating what their and hopefully enhancing what their pre-child weight body looked like. So the ideal candidate's based on BMI and the causation of what they want to correct, if that makes sense. The ones that are not good candidates are ones that have a BMI above 30 and they haven't lost much weight. So they just want breast and tummy surgery to try and improve what they have, but they haven't lost the weight. And that means they won't have the skin stretch. And it will be, they'll traditionally have, thicker fat above the muscle and thicker fat under the muscle. So it's harder to get a much more improved shape, if that makes sense. And there's a higher risk of wound complications.
Okay, lovely. I'm going to go across to the Q&A section now. So what sort of results would you expect from abdominal liposuction without a full tummy tuck?
That's a really good question. And again, it's 100% patient specific. So what I'd say, I've done hundreds of abdominal procedures, and I'd say the vast majority, we're looking at 80 to 90% would be full tummy tucks with liposuction, and a smaller percentage of just liposuction or mini tummy tucks and liposuction. So it's impossible to see without seeing a photo. People that would benefit from just liposuction will be normally people that haven't had children traditionally, that have good skin quality, but have, stubborn areas of fat that they really want to address. So someone says, look, I really don't like my love handles, or really don't like this fat above my tummy button. They have an area to focus on. It's rare to have a tummy that you can just do liposuction alone on it. And there'll be a transformative, change, if that makes sense. But it very much depends on patient selection, what's the cause of their issues and what they want to achieve.
Yeah, okay, lovely. Another question coming in for you. What's the biggest transformation you've done?
So, there's two examples I'd say that I've personally done, and I've done several of each, if that makes sense. So probably the biggest transformation is someone that's lost an awful lot of weight. I mean, gone from BMI of 45, been over 20 stone, and is now sort of 9 stone and BMI of 20. So that's a real sort of patient and surgeon working together.
Yeah.
And that will normally be a combined procedure, breast work and tummy tuck. So, traditionally an uplift or a reduction in, breast to make them much nicer shape with a much higher nipple, and then taking out all the excess skin in the tummy. And there's a big range from an extended tummy tuck up to fleur-de-lis, which is when you have a midline scar and take a huge amount of skin. There's a few of these sort of ladies on my Instagram account that you can see a before and after. And the other type of transformation are the ones that have had huge breasts, really heavy, dense breasts that are causing back pain, neck pain, and are out of proportion with the rest of their size, and doing a big breast reduction and then doing a tummy tuck and liposuction afterwards. And again, there's some examples of those that are before and afters, and they're truly, people say they're not the same person. I can assure you they are, and there's no filters on them. But often the patient's lost weight, really good surgical procedure, and then you've continued to lose weight again. There's a few I'm waiting to share, which, really show that. And it's just incredibly satisfying, to see the patient satisfaction, the happiness, the recovery of confidence, and how it affects how they are with themselves and with the family. Taking their children swimming, going on holiday, not thinking about what to wear. So it's, my experience is mostly, regaining body confidence. It's not sort of enhancing things just to make them look just that little bit better, if that makes sense. It's a real transformation. Yeah,
lovely. Are most of your patients South Wales based? Is another question.
Very good question. It's been the tradition to treat people that are local to you for various reasons. But I think in the age of social media, when photographs of results are more accessible, then my experience has been people are really willing to travel. So I've done clinic today, and I've had people from London, Scotland, Northeast, Northwest, but a good selection of local patients as well. But I'd say probably more than half of my patients travel now from different places.
Oh, brilliant. Okay. And what is the wait time for a mummy makeover currently?
So, yeah, that's a really good question. It's difficult to give an exact figure. And I'm finding that unless people are quite persistent to look for cancellations, my clinics can be booking up for sort of 3 or 4 months at a time. And then there's a wait for operations. I tend to be able to operate on someone within 2 to 3 months of seeing them is my aim. And there are circumstances where I've had a last minute cancellation, or I can request an extra list and it can be quicker. So if someone's got a wedding or a really important event, then I'll do everything I can to try and fit that in, liaising with the team at Sancta, looking at availability and trying to fit that in. But one of the problems with people traveling is that obviously there's limited capacity to see them in clinic, and I want to see everyone in clinic. It's normally at least an hour, slot, and then I can answer questions over email afterwards.
Yeah, that's great. Okay. And yeah, so from kind of consultation to the time they come in then for surgery.
Yeah, I'd say it's certainly within 3 months I'd aim for, and sometimes it's within a few weeks if there's a slot available.
Yeah. Okay, brilliant. That's great. Okay, another question has just come through. So if I end up getting pregnant after I've had my mummy makeover, how will that affect my body?
That is a good question. It's very hard to predict. We all know people that have children, it doesn't affect their bodies that much. I'd say there's a likelihood it's going to change the result relatively significantly, particularly of the breasts. Because obviously, when you have children, you're preparing for breastfeeding, the milk can come in and it will enhance the volume, and then you'll lose the volume. So it's likely to make a change in the skin envelope of the breast. Tummies are a little bit more resilient, but if you have a big baby, obviously it may stretch the skin again. It's unlikely it will go back to how it was before. And the majority of my patients, they're at a stage where they've either completed the family or they're not planning on having a child for quite a few years.
Yeah.
I'm not in a position to advise people when to have it for themselves, if that makes sense. But I've been in it for a long time. I've done hundreds, and I haven't had anyone come back and say, look, I've had children soon afterwards and it's completely wrecked the result. I need to have one again.
Yeah. And what about the scarring kind of from, previous C-sections, that sort of thing? Can that affect your surgery then if you've got some?
Yeah, so it's technically a bit more difficult if there's a scar there from a cesarean, but I do so many that it's pretty routine. I've done them with midline scars, with cesarean scars. So it just adds a few minutes on to surgery, but you just carefully dissect it up. It's certainly not a contraindication, and it's often helps a lot, to remove that scar and, get you a nicer scar, which is a bit lower down. It's a bit longer, but it's rare to have a tethered scar when a plastic surgeon does a tummy tuck.
Okay, lovely. Any tips for kind of quick recovery?
So I think the lower the BMI is, definitely the quicker the recovery. So I'd always, whenever surgeons ask patients to lose weight, it's not to be mean. And we know it's really difficult, for everyone, with work, with children, etc. Diet is 80% of the battle. Exercise isn't, you don't have to be going to gym 3 days a week. But certainly low BMI has better recovery, lower wound complications, etc. Obviously eating and drinking healthily, drink lots of water, clear fluid, proteins, vegetables, etc. I like my patients to have a binder for 6 weeks afterwards. It gives a bit of support, tends to reduce the swelling, and also rest for 2 weeks. So normally, surprisingly, after mummy makeovers, my patients feel great within a couple of days. Some just take paracetamol. They can almost be done as a day case, most of them. And I know what ladies are like, particularly with children. They're busy. active. We want to get up and do the housework. And the only, the few complications I've had often are because someone said, oh, I've done a bit too much, or I've lifted this and I shouldn't have done, or I've, done a bit of hoovering and then I've got back down and lay down straight away. So it's rest for 2 weeks. The first two weeks is crucial. And there's all sorts of advice for scarring afterwards, scar massage, different creams. There's some silicone-based dressings which are really helpful, but we can discuss all those at the consultation.
Yeah, that's great. Okay. And what does liposuction include, and what is it exactly?
Well, liposuction is suction of fat, essentially. So it's with a metal cannula. You remove the fat and you suck it and remove it. It depends what body area you're doing it on. In the tummy tuck, I traditionally do it in the hips and the flanks, and then some in the central abdomen. You can physically see what you remove, which a lot of patients quite like. It's anything from a sort of 1/4 kilogram up to, sort of 5 to 8 kilograms in extreme cases. Normally it's a fine tuning rather than a cure in itself, if that makes sense. The tummy tuck is, the majority of the shaping, and you remove a lot more fat from the tummy tuck than you do in liposuction.
Lovely. Okay, great. And there's a lot of bruising, I think, with the liposuction as well. You expect
yeah, sometimes it's variable. Yeah, sometimes my technique, I've published my technique, which is a bit different, and there tends to be less bruising with that and a faster recovery. But yeah, there is a chance of bruising but that's normally, self-limited to a couple of weeks after.
Yeah. Okay. That's lovely. That's all great. Another question. Do you do any other surgery other than a mummy makeover?
Yeah, well, I do a lot of breast work. So a lot of breast implants, lots of uplifts, reductions, implants, uplifts, removal of implants, replacement of implants, obviously hundreds of tummy tucks. So mummy makeovers is breast and tummy, and I do lots of breasts and lots of tummies. And it's just, after you do a lot of combined procedures, you know how to optimize each one. So I try and break down each section and try and optimize each little bit of it. So I tend to focus on those. I also do blepharoplasty, eyelid lifts, etc., arm lifts and thigh lifts, although less commonly. But that can be part of weight loss surgery.
Okay, that's brilliant. Thank you, Iain. That's lovely. I'm just I can see Amar has joined. So now I'd like to welcome Amar Ghattaura to the webinar. Like Iain, Mr. Ghattaura is a key part of our cosmetic surgery team here at Sancta Maria, and undertakes a number of different specialisms. Amar, would you mind introducing yourself, please?
Yeah, my name is Amar Ghattaura. I'm another plastic surgeon working in the Sancta Maria. So just to recap my story, I was thinking about this. I've been in plastic surgery since 1998. I thought about that, so 24 years. So I bet there's people on this webinar who are younger than that, and that's a scary thing. I spent most of my time before I came to Swansea in London, and I got a lot of experience there, which is great, and hopefully I brought that to us here. I've worked in places like the Royal Marsden, Great Ormond Street, Harley Street, and then Ghent. So it's a mixture of different places that have culminated in my work here. And my work here mirrors a lot of my NHS work, which is breast reconstruction after cancer. So it's a hyper specialism in that sort of work. That's exactly what I did today. I've done an NHS case. We've done a breast cancer case. Removed the breast, then transferred tummy tissue up to the breast. And my cosmetic practice kind of followed that a little bit. So again, like Iain, it's a lot of tummy work, it's a lot of breast work. And I suppose my other little area is skin rejuvenation and improving the quality of skin through the use of lasers and various different machines. I think those two go together, because there's only so far you can get with using a knife and doing surgery. There's other things you need to add on to your treatments. And as Iain said, we often add different creams and different methods of improving scars, but improving the skin quality is also a super important bit. And I've got a real interest in that.
Yeah, lovely. Okay. So we've got a couple of questions for you, Amar, that have come through already. And again, we've got the Q&A session open as well. So one of the questions that come through is, I want larger breasts, but I don't know what the size will look right for me. How do I decide, or how do you help me decide what's right for my frame?
Okay, but that's a very common question. I see a lot of breast implant patients in my clinic, as you can imagine, and they're often worried. Yeah, absolutely, as you said, they're worried they're going to be too big or not be satisfied with the outcome. And it's a process in where you can talk to people and take them through the journey. And there's various different ways of doing that in clinic. First of all, I'll look at them. I'll look at their skin. I'll look at the width of their chest, and I can work out what sort of implants will work for them based on the width of their chest. I'll look at their skin quality, and I'll know what their skin's like and what sort of implants they can take. My general view is to not go too big with implants. And the reason for that is that the bigger the implant, the more long-term complications you'll get. And although it seems quite nice to go big, some people say, I want to go big or go home, which is a funny phrase. Actually, it can end up with problems. And the problems are the skin stretches, the tissue stretch irreversibly, and then you just end up with big droopy boobs, which nobody really wants. Yeah. So the idea is to try and make the breast shape as good as possible with the right implant, with the right shape of implant. You know, I often go through round implants or teardrop implants in the right position, whether it's above or below the muscle, and getting the volume right. It's a few different factors.
Okay, lovely. That's great. Okay, and another question. I want a breast reduction, but I'm scared there will be too much excess skin.
Yeah, I mean, that again is a really common question. And as to a plastic surgeon, it seems very obvious, but I get the fact that it's not obvious to everyone. Yeah. Is that with a breast reduction, you are reducing the volume of the breast, the inside bit of the breast, but you're also reducing the skin. So a breast uplift is just removing the skin, it's tightening the skin, but not removing the volume. So you want to go from a droopy boob to a slightly higher breast, but make the shape good. Whereas a breast reduction is about reducing the skin as well as the inside. So breast reductions remove skin as well. So you won't end up with saggy skin. And in fact, a lot of the time we kind of over tighten the skin a bit, accepting a bit that will stretch over time.
What is the recovery time like for a breast enlargement surgery?
Look, with all these sort of things, it's not too bad. We've got a fairly good regime afterwards. There's things you can do to make your recovery better. Wearing a sports bra afterwards not only helps the swelling, but reduces the pain of movement in the breast as well. Small amounts of painkillers, paracetamol, sometimes Brufen in the early days help. Most people take a week off and relax at home for that week. And the second week, a lot of people get back to work from home, maybe working on the computer, making phone calls, and probably get back to proper work at about the third week. So 2 weeks off work is a good time to have off after breast reduction. I tell most people to keep off heavy stuff, like heavy gym stuff, for about 4 to 6 weeks.
Yeah.
People get back to contact sports at about 3 months.
Okay, that's lovely. Yeah, one of the other questions come through, which is about diet, kind of post-op advice diet or kind of pre-op advice diet, I suppose, same sort of BMI.
BMI is really important, you know, and I just heard the end of Iain's talk and I agree with that entirely. We're not trying to be cruel here, and we know it's difficult to lose weight, but we also know that with a higher BMI, your complications become much higher as well. Wounds breaking down is one of the main ones with the breast reduction. After surgery, it's really just about having a good diet, and that means trying to eat protein, number one, which is going to be important for your healing in the early days. Get people to drink lots of water, keep their legs moving. All these sort of things are helpful, but it's just a good diet.
Yeah. Okay. Lovely. Obviously you've touched upon the breast cancer cases and things. So another question's come through. How long after mastectomy can I have reconstructive surgery?
It kind of depends on what your other treatments were after your mastectomy. So patients who've had mastectomies alone can get on and have their reconstruction within 3 to 6 months, as long as the scar's healed. If they've had radiotherapy, that changes things because the skin changes and becomes thicker and harder, and it gets hard to lift it up. So we would generally recommend, after radiotherapy, delaying reconstruction by about a year. Okay. Some patients have chemotherapy after their mastectomy, and they also need to wait until all their blood blood results have stabilized, and their skin is matured as well. So with those people, again, the same amount of time.
Okay, lovely. That's great. Can I still breastfeed after breast surgery?
Depends what sort of breast surgery you have.
Okay.
So if you have a breast reduction, an integral part of that is moving the nipple from a low position to a high position. Same with a mastopexy, which is an uplift. And in those patients, there is the risk that the milk ducts get damaged. And in about 80% of patients, they are unable to breastfeed or have a reduced ability to breastfeed. So about 20% can carry on breastfeeding as normal. If you compare that to patients who have breast implants, where we're not damaging the nipple ducts or the milk ducts, then breastfeeding should be normal, and you can breastfeed as you would have done before. It won't do any difference at all. And some people say, well, if I have an implant, will there be silicone in the milk? Would there be a leakage or anything? And the answer to that is no, your baby's safe. You can breastfeed as normal.
Okay, great. How will aging affect the reconstructed breast?
Aging is cruel.
I agree.
It's cool. So it does lots of things with aging. You know, you will lose elasticity in your skin. You'll lose elasticity inside your breast as well. Now, if you have an implant reconstruction after cancer, that's a static object that will just stay as it is. It's not like normal tissue that kind of loses elasticity. So that stays quite firm. And your other breast will lose elasticity and become lower, perhaps droopier, smaller perhaps. So the difference between the two breasts becomes more enhanced. Now, if you have a different type of reconstruction, which is the one I do mostly, which is transferring the tummy tissue up to the breast, then that's your own flesh. And in those cases, your breast reconstruction will age in the same way as your normal breast would age. So if one gets lower, the other one gets lower. If one puts on weight, the other one puts on weight. If you lose weight, both will lose weight. So that it's responsive to your normal weight changes, and it's responsive to the normal loss of elasticity in your tissue. So both droop equally. And that's one of the reasons why it's a good long-term operation.
What are the options for breast augmentation? So I've got kind of silicone or body tissue. I know you just briefly touched upon that as well. Under the muscle, over the muscle.
Yeah, I mean, it's a big topic, and it's something we talk about in detail in clinic. And so when it comes down to making your breast firmer, first of all, we think about why we would choose a breast implant over your own tissue. I'll talk about the tissue bit first. If you were to use your own tissue to make your breast bigger, generally it's fat transfer. So we're doing some liposuction from another part of your body, perhaps your tummy or your flanks, spinning the fat and then injecting that back into your breast. Now that produces a very small increase in breast volume. So most people would need 2 or 3 goes, and you might increase your breast size by about half a cup to a cup size, but it's natural. It's your own breast tissue. And once the fat's gone inside your breast, it's the bit that survives will be there for good, but it's soft. An implant can take you up a large increase in cup size. So you can go from an A cup to a C cup, or an A cup to a D cup in some cases. And it's done in one quick operation. And it gives you firmness. So whereas your own tissue won't be firm, a silicone implant gives you firmness, and it gives you projection, which is the sort of sticky outness. And that's permanent. So some people would prefer that as a quick operation to give you what you've lost over the years, which is firmness. Now, the implants of the various different types, as you've touched upon, there's the ones that have saline on the inside, and there's ones that have silicone on the inside, and there's pros and cons of each. In America, there was a big drive towards saline implants for many years when there was concern over silicone, but they kind of use silicone now as well now. In Europe, we've carried on with silicone and shown it's safe. And it gives you a breast that feels like a breast. It feels firm and it's warm. And it is a good operation, I think. I think probably 98% of my patients have silicone implants, and a very small number have saline implants. You can change the shape of the implant. You can have round implants, teardrops. I do a lot of teardrop implants because I think it gives it a really natural shape. It gives you a very
because it's more like a natural shape, the teardrop. Yeah.
Good upper half to your breast. And there's different types of teardrop implants you can choose. You can choose the tall height ones, the medium height, low height. So there's a lot of play with teardrop implants that I really like. And then it's above or below the muscle. And that really comes down to my patient's physique. So if they are really slim with not much breast tissue, then I'll generally go underneath the muscle because it gives another layer of padding, particularly on the upper bit of your breast. If they are a bit fuller, then you can have an implant that goes above the muscle, and you can get a good result with that as well. But it has to be chosen. It has to be the right patient.
Yeah. Okay. I'm 19 and I have always been self-conscious of my breasts. They're too big. I've lost weight, but fat stays on my breasts. What would you advise?
Well, number one feature is that she's young. This patient's 19 years old, and it's an important factor. Now, I have done many breast reductions on 19, 20, 21-year-olds, very young girls. And the reason is if you have heavy breasts, they cause lots and lots of problems. They cause back problems, neck problems, and major confidence problems in the 20s. And you can try and persuade somebody there who's 19 to keep their breasts until they've had children, maybe in wait till their 30s. But that's your 20s where you're unhappy with your breasts and they're heavy and they're causing functional problems as well. So it's an acceptable thing to do in someone that age. Now, the key factor is something we've already touched upon, which is if you reduce the breast at 19, you're going to be moving the nipple around and cutting into the milk ducts. So for somebody who's 19, they have to expect that they won't be able to breastfeed. And some people, that makes a massive difference. I told that to a girl only last week, and she said, well, that's off then. I don't want to have the surgery. I want to wait. And that's okay. That's a good thing to know. If breastfeeding means a lot to you, then you should wait. If you can accept that you won't be able to breastfeed, then it's a reasonable thing to do. And if you can accept the scars that you get with a breast reduction, which are kind of anchor-shaped scars.
I'm 62. Am I too old for a breast lift?
No. I did a major breast reconstruction in a 76-year-old last year. So age is not the factor, because there's lots of patients I see who are 30 and they're not medically fit for surgery, and I'll say no to them because either their BMI is too high, or they smoke 30 a day, or they've got multiple medical problems. So somebody who's in their 60s who's fit and healthy, it's a very good operation, and I've done it on many 60-year-olds. 60-year-olds look great now; they look after themselves, and it's a safe procedure to do.
Okay. Do you do any nipple work? I have very large areolae.
Yeah. So people come to me for concerns over their nipples, over just that large areola, the brown bit around the nipple. Some people say their nipples are inverted. I do a lot of nipple reconstructions for women who've had cancer work, and I need to make a nipple for them. So it's a really important part of the breast, the nipple, and getting the right size and shape is important because it is a key feature of the breast. Now, reducing the nipple means a scar that goes around the nipple, all around the nipple. So it's a circular scar, and it can reduce the size of the nipple as well as improve the sort of pointiness of the nipples that some people get as well. So it's very possible. And some of those cases can be done under local anesthetic with you awake.
Okay. Oh, that's lovely. Okay. Okay. Interesting one. Will a breast augmentation increase my risk of breast cancer?
No. So there's lots of evidence on this. We wouldn't have been doing it for decades if there was a connection between breast implants and breast cancer. The key one to know about is something called ALCL, anaplastic large cell lymphoma. So there has been a link between textured implants. Textured are the implants that are kind of roughened up on the outside, and something called lymphoma, which is a blood cancer. But it's rare. It's in about 1 in 15,000 people. So everyone that comes to my clinic to talk about this, I'll go through that with them and tell them the pros and cons of different types of implants and what effect that might have on them.
If I have a boob job, will I need to continue to have a boob job every few years?
No, a few years sounds like it's just a couple of years down the line. So if you have breast implants, lots of people come to me after 10 years and say, should I get them changed now? And I'll say, well, have you got any symptoms? Are there any problems at all? And I say, no, I love them still, no problems at all. And as long as they are looking okay and they feel okay, as they haven't gone hard, or there's no signs of a rupture, where you can generally find they feel quite soft and they have a burning sensation, I'll say just keep them in. So I won't advise people just to change them just because it's 10 years down the line. It's only if they have a problem. What I generally say at 10 years is to get an ultrasound scan. So I'll send them off for a scan just to rule out any hidden ruptures, or what we call silent ruptures, which is the silicone has leaked but they've got no symptoms. And in those cases, they have to change them. But I've had people have had them in for 40 years. I've had the longest I've heard. But it's common for a patient to come to me after 25 years to have their implants exchanged. So there's no need to change them quickly unless you have a problem. And the most common reason why people do come back is not because there's a rupture or hardening. It's because they've drooped. They've had kids perhaps, they've dropped down, and actually what they want is the implant to be removed and an uplift, or maybe the implant to be exchanged and an uplift. That's kind of a common operation in the 40s and 50s age group.
Can I sleep on my front following a breast augmentation? And if not, how long until I can sleep on my front?
You can sleep on your side at about 3 to 4 weeks after surgery. It's not too bad. It's more like 6 weeks to sleep on your belly. Sleep on your front with your breast down. By that time, the implant's kind of bedded in place and nothing bad's going to happen. So about 4 weeks for the side, 6 weeks for you lying on your belly.
Will my nipple sensation or feeling change after having breast implants?
Yeah, commonly, yeah, it does actually. It can either go down, which is more common actually. On some people, it becomes hypersensitive. So even the touch of clothing or their bra can cause a bit of pain. And most times it gets better by itself. Most times. Some people are left with no feeling in their nipple after surgery, but that's not common. Normally it settles down by a year, but it's a good question because it's something I warn every patient about.
Okay, brilliant. Okay. Okay, I love weightlifting and trying to keep fit. Will I be able to do this after breast reduction surgery?
Yeah, very easily actually. Remember, the breast reduction surgery is all above your pec major muscle. Pec major is the muscle that you're going to be using when you're doing your weight training, upper body weight training. So for most people, I say keep off heavy upper body training for about 4 to 6 weeks after breast reduction. For breast implant surgery, it's different. It does make a difference there because especially if you put an implant underneath the pec major muscle, so under the muscle, which some implants have to go, and that can affect the strength of the upper body. But I've done a few female bodybuilders now, professional bodybuilders who've had implants, and their ability to train has gone down initially, but they've got back up to normal after about a year, even if the implants have been below the muscle. So even with that, at a high level, they've got back to normal. So breast reduction is absolutely fine. There's no problem at all getting back to training at about 4 to 6 weeks.
That's great. Okay. How can I prepare for breast surgery? Is there anything I can do to improve the elasticity of the skin? Any creams, that sort of thing?
Not really, actually, before surgery. Before surgery is just about staying healthy. If you've been off cigarettes, stay off cigarettes. After surgery is the normal stuff we spoke about. In terms of skin elasticity, once you've lost some of your elasticity in your skin through loss of collagen, there's not much you can do with it, to be honest, with creams. Some creams help a little bit, but not a huge amount. So again, this comes down to the other thing I was talking to you about, which is my other interest is plumping up collagen in the skin. And that's something you can do with the laser treatments or with radiofrequency treatments. To give you a collagen boost. It's mainly facial work, to be honest, but a little bit's done on breasts. Quite a lot of it we do on tummies as well. So from the sort of loose tummy, but not bad enough, I do a tummy tuck on them. The middle ground in plumping up the collagen on those patients is pretty easy with some of the machines we've got.
Okay, I'm scared of an implant rupturing. What can I do to reduce the risks of this?
The implant rupture is not common. And first thing to say is if it ruptures and the silicone comes out, it won't harm you, it won't poison you. That's the thing most people are scared of.
Yeah.
The most common thing is you get a bit of irritation in your breast. It feels like it's burning. Sometimes your breast starts feeling really soft, whereas the other one felt quite firm. So most of the time you'll get some signs that there's something happened. Very occasionally, the silicone can move up towards your armpit, and one of your lymph nodes in your armpit can get bigger, which causes some concern because people worry that could be a cancer. But it's not. There's nothing to worry about. So with that, if any of these symptoms happen, go and see your plastic surgeon. So if a patient sees me with that, I'll send them off for a scan. If it's not ruptured, it's all good. We can relax. If it's ruptured, what I'll say is the implant should be removed at a suitable time, within a month or two. No rush on it at all. Nothing bad will happen. And when I remove the implant, I'll take the implant out and the scar tissue around the implant as well. and most times put a new implant back in again, and they're back to normal. Nothing, there'll be no long-term consequences of that rupture. I tend to always send the implants back to the implant company for them to check the implant out. And quite a lot of the implant companies now will give a refund of some of the money towards the patient, for the implants if they've ruptured, because quite a lot of them have a lifetime guarantee on them nowadays. So it's always worth sending them back, and they'll analyze them as well and see if there's any structural fault with them.
Okay, brilliant. Okay. So any kind of final words of wisdom for anyone who's looking for breast reconstructive surgery or breast augmentations, any sort of breast surgery that you do?
Yeah, I mean, look, they're different. So breast reconstruction is always after breast cancer treatment generally. And look, with that, I'd say just make sure you see a plastic surgeon, because we can offer lots of treatments that non-plastic surgeons don't do. With cosmetic surgery, and that is your breast reductions, breast uplifts, breast implants, just talk to your plastic surgeon at length. You know, I would generally see patients twice and understand the pros and cons of each of these procedures. What I generally suggest is that you go from, if you're going bigger, you go from a small breast to a medium-sized breast, and that's generally A's and B's to C's and D's. If you're coming down in size because you're too heavy and you're an F or G plus or that sort of thing, then I'll say I'll get you from a big breast to a medium-sized breast, which is a C or D. So just getting down to medium size. So medium size means you can buy a bra from a shelf, you know, you can wear normal clothing, and it's a much easier breast to kind of live with in the long term, because you won't get back problems with it.
Lovely. And like, you know, like yourself and Iain have touched upon, the BMI, eating healthy, not smoking, those sorts of things that are just seem to be vital to
they're given in terms of any surgery, to be honest.
Yeah.
Are sort of my breast work or my tummy work or any of the stuff I do. That's one of the basics of surgery, really, to get your health in order before you undertake this sort of thing. Yeah,
brilliant. Okay, so we're looking to bring the webinar to a close now, as I'm sure we could talk about this all night though. Just to say, as I said at the beginning of the webinar, this will be recorded, and we'll be sharing the webinar on social media next week, and we'll also share a Q&A of any unanswered questions as well. Just a reminder, if you would like to organise a consultation with Professor Iain Whitaker or Mr. Ghattaura, please contact us directly on Sancta Maria website, and we can get those consultations booked in for you. You can also see their profiles online. On behalf of myself and Mr. Ghattaura, we'd like to thank you so much for joining, and we hope you have a lovely evening and the best of luck with your individual cosmetic surgery journeys. Thank you, Amar. Thank you for joining. It's been great.